More eyes and ears are being placed in Health Sciences Center's emergency department to prevent further tragedies. Healthcare aides have been trained to monitor patients in the waiting room and check their vital signs. The move comes following the death of 49-year-old Chad Giffen in January. With more, CTV's Jeff Keele joins us now live. Jeff, how do healthcare workers feel about this plan?
The union representing healthcare aides says this helps free up nurses, but the nurses union has safety concerns. Outside Health Sciences Center, Lowell Thomas says his wife is having stomach pain. They waited in the emergency department last week for about 8 hours.
It shouldn't take that long.
And while they waited, his wife couldn't control the saliva coming from her mouth because of her condition.
And I was trying to get help, can you help her help me clean her up, I don't want her to see my wife like that. So I tried to ask him, there was nobody around.
Now the province is making changes to assist and monitor patients while they wait.
One of the fundamental pieces was improving capacity.
15 healthcare aides have been trained to check on patients and their vitals in the ER waiting room. The move stems from an investigation following the death of 49-year-old Chad Giffen at HSC in January.
What we've done as a government is make sure that consistently across our emergency departments, not only are they staffing to baseline, but going above that by utilizing the skills of healthcare aides.
But the Manitoba Nurses Union is concerned about the plan.
When you go to emergency department, you go there for medical care, and that should be provided by a nurse.
It says a healthcare aide's skill set is limited. They worry they could miss something a nurse could catch, like a small change in someone's color or pulse.
They may not know that that is a significant change that needs to be quickly intervened, and that there could be some safety issues.
They have been already doing that for several years.
But the union representing those aides says they've been checking vitals in the ER since Brian Sinclair's death at HSC 17 years ago.
It should already be helping, because the more eyes you have on the patients that are sitting in the ERs, the better. And it certainly helps to free up the nurses.
The Healthcare Aides Union, CUPE Local 204, says it does have one concern. It wants to make sure members are not doing work beyond their scope and having additional workloads.